I want to tell you about a mistake I've watched happen in the kitchens of my patients over 60 more times than I can count. The moment they hear the words prediabetes or type 2 diabetes, they walk to the fridge and one by one, they pull out every wedge, every tub, every slice of cheese, and they throw it all in the trash. They've been told saturated fat is the villain. They've been told dairy is a landmine. So they cut it out completely. And in doing that, they accidentally give up one of the steadiest, most useful tools their body has for managing blood sugar. I need you to hear this clearly, because it goes against almost everything you've probably been told. The right cheese, in the right portion, does not spike your blood sugar. Certain cheeses can actually slow down how fast sugar hits your bloodstream from the rest of your plate, support the very cells in your pancreas, still capable of producing insulin, and help lower your risk of the complications that come with years of poor control. That's not a feel-good claim. That's basic biochemistry, and today I'm going to walk you through it, cheese by cheese. I'm going to give you 5 cheeses that show up again and again in my recommendations for patients managing blood sugar, and for every one, I'll explain exactly what's happening inside your body when you eat it, how much is actually safe, and how to pair it. Stay with me until the very last one, because it's the cheese almost nobody thinks of as medicine. Most people only ever reach for it as a garnish, and it happens to carry one of the most important nutrients for how your pancreas behaves. I'll also tell you, near the end, about 3 cheese aisle products that pretend to belong on this list and absolutely do not. Knowing the difference matters just as much as knowing the 5 good ones. Before I get into it, do me a favor. In the comments, tell me your age and whether cheese is still in your kitchen or whether you tossed it the day you got your diagnosis. I read every comment, and it genuinely shapes what I cover in future videos. Now let's clear up the confusion, because there's a piece of this almost nobody explains properly, and it changes how you should be reading your own glucose meter. Cheese, on its own, carries almost no measurable glycemic load. It barely moves a blood sugar reading in the way bread or rice does. But that's only half the story. A meaningful portion of the protein in cheese, somewhere in the range of 1/3 to over half of it, can eventually get converted into glucose by your liver, a slow background process that typically shows up 2 to 3 hours after you've eaten, not right away. The fat in cheese adds its own small, delayed nudge to your blood sugar even later than that, often 4 to 5 hours out. It's a fraction of what carbohydrate does, and it unfolds far more slowly, but it's a real effect, and if you don't know to look for it, you'll miss it completely. Here's an easy way to picture it. Refined carbs behave like a match tossed onto dry newspaper, a fast, sharp flare that burns out almost as quickly as it started. Cheese behaves more like a cast iron pan left on low heat. There's no dramatic spike, just a slow, even warmth that lingers. If you only test your blood sugar an hour after a cheese-heavy meal, that pan looks cold, and you'll conclude cheese didn't do anything at all. Test again 2 or 3 hours later, and you might catch a gentle rise you weren't expecting. That's not the cheese working against you. That's you checking the clock at the wrong moment. And this is exactly why portion size matters so much more than most people realize. Somewhere around 1 to 2 thin slices of a firm cheese, or a few tablespoons of a softer one, tends to be the sweet spot. At that amount, the protein and fat slow gastric emptying and help trigger GLP-1, the same gut hormone that drugs like semaglutide are designed to boost. Get the portion right, and cheese becomes a buffer that protects the rest of your meal. Get it wrong, and it quietly adds to your load instead. Research looking at large groups of adults over long stretches of time has repeatedly linked regular, moderate cheese and yogurt consumption with a lower likelihood of developing type 2 diabetes in the first place. The exact reasons researchers give for this vary: the calcium, the probiotic cultures, the protein itself. But the pattern shows up often enough across different studies that I've stopped treating it as a coincidence. I also want to address the question I get asked constantly, which is whether low-fat cheese is the smarter choice for someone watching blood sugar. In most cases, no. Stripping the fat out of a cheese does nothing helpful for glucose control, and it often means manufacturers add starches or gums back in to fix the texture, which can quietly reintroduce carbohydrate you weren't expecting. Full fat, in reasonable portions, is usually the better call here. With that groundwork laid, let's start the countdown. I'm going in order from 5 down to 1, because the cheese at the very top of this list is the one that surprises people the most, and I want to leave you with it. Coming in at number 5 is cottage cheese, and I'm starting here because you can find this in any grocery store in the country and put it to use tomorrow morning. Here's what most people miss about it. Cottage cheese doesn't protect your blood sugar mainly by what it does the moment you swallow it. It protects you by what it prevents 2 or 3 hours later. In a typical serving, you're looking at roughly 100 calories, somewhere close to 12 grams of protein, and only a few grams of carbohydrate. That's an unusually favorable protein to calorie ratio for a dairy product you can grab off any shelf. When you eat that much protein for that few calories, your body releases hormones like peptide Y and cholecystokinin that keep hunger quiet for hours afterward. For someone over 60 trying to manage glucose, that matters enormously because most of the damage isn't done by the meal in front of you. It's done by the handful of crackers you reach for at 3 in the afternoon when hunger sneaks up and the pantry is right there. A bowl of cottage cheese at breakfast closes that door before it opens. There's a quieter, slower benefit too. Cottage cheese is a solid source of calcium, and research has repeatedly connected adequate calcium intake with better long-term insulin sensitivity. It's not dramatic. It builds over months, not days. Let me tell you about a patient of mine, Diane, 64 years old, who came in with an A1C sitting at 7.4. She'd cut dairy entirely 3 years earlier because a well-meaning friend convinced her fat would make everything worse. She was tired, snacky by mid-afternoon, and her numbers weren't budging. I asked her to try one change. Half a cup of plain cottage cheese with cucumber and black pepper at breakfast, 5 days a week. 4 months later, her A1C had dropped to 6.7, and she told me the 3 o'clock cravings had all but disappeared. One warning here. Check the label before you buy. Plain cottage cheese is your ally. The kind swimming in pineapple syrup or fruit-on-the-bottom flavoring can carry 15 to 20 grams of added sugar per cup, which wipes out every benefit I just described. If the ingredient list mentions syrup or juice concentrate, put it back and grab the plain tub instead. Stir and berries yourself, or use it as a savory spread on whole grain toast in place of cream cheese. While we're on the subject, let me ask you this. When's the last time you actually checked your blood sugar 3 hours after a cheese-based meal instead of just 1 hour after? Drop your answer in the comments. Almost none of my patients have ever been told to look at that later window, and once they do, it changes how they read their own numbers. Number 4 on this list is fresh mozzarella, and it earns its spot for a reason that has nothing to do with protein and everything to do with your gut. In a typical serving, you're getting close to 20 grams of high-quality protein, essentially no carbohydrate, and noticeably less fat than most aged, hard cheeses. But the real story is fermentation. Fresh mozzarella carries live bacterial cultures that act like gentle probiotics as they move through your digestive tract. And over the last several years, the link between your gut microbiome and how sensitive your cells are to insulin has become one of the most closely studied areas in metabolic health. A diverse, well-balanced microbiome produces short-chain fatty acids, butyrate among them, that appear to directly support the beta cells in your pancreas, the ones still trying to manufacture insulin. A healthier gut also tends to lower the low-grade inflammation that quietly worsens insulin resistance as we age. I think of my patient Walter, 68, who showed up with an A1C of 7.1. He'd been avoiding dairy altogether, worried it would push his numbers the wrong direction. I asked him to add roughly a 2-ounce portion of fresh mozzarella to his lunch a few times a week, paired with sliced tomato, basil, and a little olive oil. Essentially a simple caprese plate. 3 months in, his A1C had eased down to 6.6, and his energy through the afternoon had noticeably improved. A quick caution. Sodium content swings a lot between brands, so if you're also watching blood pressure, check the label and look for a lower sodium option. And skip the shrink-wrapped string cheese aimed at kids' lunchboxes. It's a completely different, more processed product that doesn't carry the same benefit. Number 3 takes us to Feta, and this one earns its place because of the specific animal the milk comes from, not just the cheese itself. Genuine Greek-style feta is made from sheep's milk, or a blend of sheep and goat milk, and sheep's milk carries meaningfully higher levels of a fatty acid called conjugated linoleic acid, or CLA, than cow's milk does. CLA has come up repeatedly in research tied to improved insulin sensitivity, and this is the part that matters most for patients over 60, a reduction in visceral fat specifically. Visceral fat is the deep fat that wraps around your liver, pancreas, and intestines. You can't pinch it at your waistline, which is exactly why it's so dangerous. It sits there quietly, working against your metabolism from the inside. I sometimes compare it to sludge building up inside an engine block. From the outside, everything looks fine. Under the hood, every part is straining harder than it should, and wearing out faster because of it. That's what visceral fat does to your pancreas and liver over time, and it's one of the biggest drivers of insulin resistance in people over 60. A typical serving of authentic Feta gives you around 13 grams of protein and well under 5 grams of carbohydrate, and because it's fermented, it offers the same gut-friendly benefit I described with mozzarella. Two things to watch for. First, a lot of what's sold as Feta in the supermarket dairy case is actually made from cow's milk and won't carry that same CLA advantage. Check the label for sheep's milk specifically. Second, Feta is brined, so it runs salty. If sodium is a concern, rinse it briefly under cold water before serving. It cuts the salt content noticeably without changing the flavor much. Crumble it over a cucumber and olive salad, fold it into an omelet, or scatter it over roasted vegetables. We're at number 2 now, and this is the cheese I personally keep stocked in my own refrigerator. Number 2 is ricotta, and it lands here because of something almost nobody with diabetes has ever been told about how it's actually made. Most cheeses are built from the solid curds of milk. Ricotta isn't. It's made from the whey left behind after other cheeses are produced, and that changes everything about how your body handles it. The protein in ricotta is whey protein, the same protein sold in tubs at every supplement store in the country. Most other cheeses are built on casein instead. On a nutrition label, they look nearly identical. In your body, they behave completely differently. Whey digests faster, and it's rich in an amino acid called leucine, one of the strongest natural triggers for GLP-1 release in your gut, the very same hormone pathway that drugs like semaglutide and tirzepatide are built around. Research on whey protein taken shortly before a carbohydrate-heavy meal has shown mealtime blood sugar spikes reduced by roughly a quarter compared to going in without it. A quarter from a spoonful of cheese timed correctly. A typical serving of ricotta runs somewhere around 170 to 180 calories, close to 11 grams of protein, just a few grams of carbohydrate, and noticeably less saturated fat than most aged cheeses. A good combination for anyone managing both blood sugar and cholesterol at once. I think of Gerald, 73, who'd lived with type 2 diabetes for over a decade and kept hitting what he called his 4 o'clock wall. Shaky, foggy, and reaching for whatever sweet thing was closest. I had him swap that snack for half a cup of ricotta mixed with fresh herbs, a slice of whole grain toast, and a small handful of walnuts. Within 6 weeks, the crashes had stopped, and his readings before dinner were noticeably more stable. A kitchen tip. Plain ricotta tastes fairly flat on its own, which is why a lot of people give up on it. Stir in fresh basil or chives, a pinch of salt, and a little olive oil, and it turns into something you'll actually look forward to eating. And now, the cheese I promised you at the start. The one most people only ever sprinkle on top of something else. Number 1 on this list is Parmesan, and I know it's the last cheese anyone expects to see at the top of a blood sugar list, but the research behind it is stronger than most people realize. I'm not talking about the shelf-stable shaker version. I mean genuinely aged Parmesan, ideally ripened 18 months or longer, in a modest 1-ounce serving. The kind of amount you'd realistically use as a topping. You're getting roughly 7 to 8 grams of protein, more protein per gram than any other cheese on this list, with essentially 0 carbohydrate. Because the long aging process breaks down nearly all the lactose. Even patients with mild lactose sensitivity usually tolerate it without issue. But the real reason it earns the top spot is vitamin K2. Aged Parmesan is one of the richest food sources of K2 you can find anywhere, and growing research is tying this vitamin directly to how your pancreas manages insulin release. Studies following large groups of adults over many years have linked higher K2 intake to a meaningfully lower rate of developing type 2 diabetes. There's a second reason this matters. Think of vitamin K2 as a dispatcher for calcium in your body. It decides where calcium gets delivered. With enough K2 on board, calcium heads to your bones and teeth, where it belongs. Without it, calcium can end up drifting into your artery walls instead, which is a real concern because people managing type 2 diabetes already carry a meaningfully higher risk of arterial calcification than the general population. I think of Nancy, 66, who came in with prediabetes, an A1C around 6.1, early signs of bone thinning, and some calcium buildup already showing on a cardiac scan. A combination I see constantly in postmenopausal women. I asked her to add a tablespoon or two of grated aged Parmesan daily over vegetables and soups alongside her regular walks. 8 months later, her A1C had settled at 5.6, and her bone density scan had stabilized. Use it the way it's meant to be used. A finishing touch over salad, eggs, soup, or whole grain pasta. Big flavor, essentially no impact on blood sugar. That's the full 5. But before you head to the store, there are 3 traps I watch my patients fall into again and again, and I'd be doing you a disservice if I didn't cover them. The first is the individually wrapped cheese food slices that don't even need refrigeration until you open the package. I'll be blunt. That's not really cheese in any meaningful sense. It's a manufactured dairy blend built from modified starches, oils, emulsifiers, and often a touch of added sugar. It gives you none of the GLP-1 support, none of the probiotic benefit, none of the K2 content that real cheese provides. If that's what's been sitting in your sandwiches, none of what I just described applies to it. The second trap is bagged, pre-shredded cheese. To keep the shreds from clumping together, manufacturers coat them in cellulose and often potato starch, which quietly adds a gram or two of carbohydrate per serving that almost nobody accounts for. Small on its own, but it stacks up if you're using shredded cheese daily. The third trap is cream cheese. It won't hurt you in small amounts, but its protein-to-fat ratio is poor, meaning you're taking in plenty of calories without getting the metabolic benefit the 5 cheeses above actually deliver. And most people spread on far more than they realize. My rule of thumb: read the ingredients. If the list runs longer than milk, salt, culture, and enzyme, put it back on the shelf and reach for one of the 5 I just walked you through instead. 2 more things before we wrap up. If you're managing high blood pressure, heart failure, or kidney disease, pay close attention to your total daily sodium as you bring more cheese into your meals. Rinsing Feta helps, but it isn't a complete fix. Keep an eye on swelling in your ankles by evening and any sudden jump on the morning scale, since those are early warning signs worth mentioning to your doctor. And one more honest note: not everyone's cholesterol responds to saturated fat the same way. A smaller group of patients will see their LDL climb even as their blood sugar improves. If you increase your cheese intake, get a lipid panel checked around the 3-month mark, and let your actual numbers guide you from there. So here's what I want you to walk away with. Cheese isn't the enemy for someone managing type 2 diabetes. The wrong cheese, in the wrong amount, eaten at the wrong time, is. Cottage cheese buys you hours of freedom from afternoon cravings. Mozzarella feeds the gut bacteria, quietly supporting your insulin sensitivity. Feta brings in a fat that helps shrink the visceral fat wrapped around your organs. Ricotta triggers the same hormone pathway as some of today's most advanced diabetes medications. And aged Parmesan protects your pancreas and your arteries at the same time through vitamin K2. Here's your plan for this week. Pick up 2 things at the store: a tub of plain ricotta and a wedge of aged Parmesan. Between those 2, you can cover most of your meals. Next, change the order you eat in. Vegetables and protein first, and save your bread, rice, or pasta for the end of the meal. That single sequencing change lowers your after-meal spike more than almost anything else you can do at the table. Keep portions in mind: a slice or 2 of a firm cheese, a few tablespoons of a softer one, or a tablespoon of grated Parmesan. And the next time you eat a cheese-containing meal, check your blood sugar twice, once at the 1-hour mark, and again around hour 3. You'll likely see something you've never noticed before. If you take away nothing else, take this. The goal isn't to eat as little as possible for the rest of your life. It's to know which foods are quietly working for you and which ones only look dangerous because nobody ever explained the biochemistry. Cheese, done right, belongs in the first category far more often than most people over 60 have been led to believe. And if you want one thing to bring up at your next appointment, ask your doctor whether your vitamin K2 status and bone density are worth checking alongside your usual blood work, especially if you're a woman past menopause. I'll leave you with one question. Of these 5, which one surprised you most, and which one is already sitting in your fridge right now? Tell me in the comments. I read every one, and it genuinely helps me understand what you're working with. And if you know someone over 60 who cleared their fridge out the day they got diagnosed, send them this video. They deserve to know which ones are actually worth bringing back. I'm Joshua Smith, After years of sitting across the table from patients working to get their blood sugar under control, I've noticed the ones who do best long-term usually aren't the ones with the strictest rules. They're the ones who learn to choose well. Everything in this video is meant to support the conversation with your own doctor. Never replace it. Please don't change or stop any medication. Metformin, insulin, or a GLP-1 medication included, based on anything you hear here. Bring these ideas to your next visit and talk them through together. Take care of yourself, and if this channel has earned a spot in your week, go ahead and subscribe before you go. I'll see you in the next one.